Hi. This week I'm going to address 5 major problems facing the United States and discuss solutions, not political criticisms, but actual solutions. And today I want to talk about health care. The Democrats always say, okay, you oppose Obamacare, but what do you recommend? And Republicans come back and they say tort reform, which is really important to lower the cost of health care, and to permit interstate competition among insurance companies, which is important. It'll lower the price of health care. But what are we actually going to do beyond those 2 basic steps? Well, first of all, I approve of 2 limited aspects of Obamacare. The one is that I believe that insurance companies should not be able to raise your premiums or cut off coverage when you get sick. The whole point of insurance is to insure. And I also believe they should be required to take all comers, regardless of pre-existing conditions, because I believe that that's the concept of insurance, spread the risk. And I think we all have to realize that if we require those steps, our premiums are going to increase. But ultimately, it's in our advantage, too, because we might get sick and we might need those safeguards, and we should be willing to pay a little extra to make sure we're going to have them. But when you get to the actual guts of the healthcare system, my view is that the key is to combine cost with concerns about your health in the same person, namely you. Right now, let's be honest, you and I could care less how much our medical care costs because we're not paying for it, and our insurance company could care less whether or not we're healthy. Ultimately, what we need to do is to make sure that we who are concerned about our health control the costs, and that way we get concerned about both costs and health. And the way to do that is to empower a healthcare consumer to be a shopper, because basically they have to be spending their own money. So I want to do nationally what Governor Mitch Daniels did in Indiana, very successfully. The program still is in place after he left office. He went to the employees of Indiana and he said, hey, look, guys, you can either keep the current insurance you have, or you can enter my new system. And the new system he set up was, I'll give you a certain amount of money every year, $3,000 or $4,000 or $5,000 a year, and you spend it on health care. You can only spend it on health care, but you can do whatever you want with it. Pay doctor's fees, pay co-payments, deductibles on your insurance company, pay the premiums, whatever you want. But if at the end of the year there's money left, you keep it and I won't tax it. And the result was that 3/4 of the state workers chose this new program, and 3/4 of them got money back at the end of the year. Because what it does is it means that you are a powerful consumer. Just like you walk in and you want to buy a car, but you don't want to spend too much money. So you're always weighing what's the worth of the car versus how much does it cost, and what's the right balance for me. That's the same decision you should be making about your health care. Now, Republicans have often proposed what's called a health savings account, which works like that, but it has to be your own money that you put aside that you're putting into your account. And what the government does is it says, I won't tax it. But that isn't a solution for any except the very rich, because most people really can't save enough money to be able to do that. So let the government give it to you conditionally, and then let you keep it if you don't spend it, whatever you don't spend on health care. I think that that really is the best way to proceed. And I think that it will reduce costs, and I think it'll maintain quality. So that's my proposal. Thanks a lot for watching.